Hello, have you ever heard about AIDS? AIDS stands for Acquired Immunodeficiency Syndrome. AIDS is the late stage of HIV infection that occurs when the body's immune system is badly damaged because of the virus. What are the exact causes of AIDS?
AIDS is caused by a virus, which is human immunodeficiency virus or called as HIV. HIV can live in human body for many years. HIV attacks our immune system by killing the CD4 T cell. CD4 T cell is a type of white blood cell that helps to fight infection. HIV replicates in CD4 cell and destroys the cell. Without treatment, HIV will kill most CD4 cells over time. The virus will keep increasing and the number of CD4 cells will decline. This will weaken the immune system. After 10 to 15 years untreated, or when the CD4 count drops below 200, the person can develop the most advanced stage of HIV infection, which is AIDS. HIV can be transmitted through the exchange of body fluids, including blood, breast milk, semen, and vaginal secretion from infected person. During pregnancy and delivery, HIV can be passed from a mother to her child. Now, what are the risk factors of AIDS? The first one is having anal or vaginal sex without protection. Second, having another sexually transmitted infection with the syphilis, herpes, chlamydia, gonorrhea, or bacterial vaginosis. Third, sharing needles and syringes when injecting drugs. And the last one is undergoing unsafe injections, blood transfusion, and tissue transplants, as well as medical procedure involving unsterile cutting or piercing.
Example of real cases of HIV or AIDS. Meet Nicholas now. He is a 52-year-old man who said that he managed to keep his HIV test negative throughout his adult life and always used protection during his sexual activities. But one day he slipped, and this led him to a severe symptoms such as flu, which is a common sign of HIV infection. He then got himself tested. 5 months later, he had been diagnosed with HIV. He said there are two ways to know if someone has HIV. They either get themselves tested or they tend to get sick. Since he had been diagnosed with HIV, he takes daily medication, 1 pill a day, and exercise regularly.
Signs and symptoms of AIDS. This is the common symptoms of AIDS: rapid weight loss, dry cough, recurring fever or profuse night sweat, fatigue, diarrhea, and swollen lymph glands in the armpit, groin, or neck.
Medication and intervention of AIDS. Medications that are used to treat AIDS, which include antiretroviral therapy, is a combination treatment with at least 3 different antiretroviral medicines. Combination antiretroviral therapy stops HIV virus from multiplying and can suppress HIV to undetectable levels in blood. This allows a person's immune system to recover, overcome infections, and prevent the development of AIDS and other long-term effects of HIV infection. It will only be effective against the virus if the pills are taken as prescribed. Next, fusion inhibitors are a class of drugs that act against HIV by preventing the virus from fusing with the inside of a cell, preventing the virus from replicating. Lastly, non-nucleoside reverse transcriptase inhibitors works by blocking the infection of new cells by HIV virus.
For the intervention, it is best for patients to use condom during sexual intercourse as a barrier method to prevent infection. Antiretroviral medicines can be taken as pre-exposure prophylaxis to prevent the spread of the HIV virus in people who have not yet been exposed to it. Next is voluntary non-medical circumcision. It has been proven that this method is very effective and reduces the risk of getting infected as the tissues of the foreskin that is vulnerable to HIV infection has been removed. Reducing the number of sexual partners will also help decrease the risk of virus infection. Patients also need to make sure to only use clean syringes and needles and never repeat using the used ones. Lastly, it is suggested to take opiate substitution therapy as it reduces drug-related mortality, offending, and ejection-based behavior, which leads to adherence improvement to antiretroviral treatment for those with AIDS.